Hello, it's the last presentation of the day. I work in Şanlıurfa and I'm specialized in children's psychology, psychiatry, and I want to talk about the artificial intelligence and ethical boundaries in child psychiatry. So we'll first of all, as my colleagues have said, the AI applications and I want to talk about privacy and ethical aspects. Before I start my presentation, we always had this question about the AI. There are different scenarios. Let's say a teenager talks with the AI system and AI sees a high suicide risk in this teenager, but the teenager and their family says that there is no such risk. Should we believe the AI or the people? A second scenario, a boy talks to a ChatGPT and shares his location and all private information. In this situation, who is responsible? The family doesn't know about the situation. Another child who is depressive due to cultural factors, and the AI cannot be successful with this child. Can we say that these scenarios are possible? The AI was very fastly introduced to child's psychiatry, so it is important to use it in early diagnosis and other things, but it also brings a lot of risks, like there is privacy of children, being clear, and regulation, control. And the aim of my presentation is to talk about them. My colleagues have already talked about the AI applications they use in their clinics, and we see diagnosing, video analysis, possibility to read the affect and patterns from a talk, genetic syndromes, possibility to recognize phenotype from a face, risk forecast and monitoring, as was described by my colleagues. AI may comment on all these situations and scenarios, like in chats or records. They can detect suicide intentions due to persons chatting. Some chatbots may give support and may be helpful in stress management. And it can be used for feedback in real time. So what are the fluctuations in behavior? And these points are very important for the medical ethics. And first of all, autonomy. Children are not capable to take decisions fully. And in my next slide, children, if children are able to understand consequences. We need to support and respect this. AI may decide about individual treatment. Do not harm. The AI may do wrong classification or wrong diagnosis. There is a risk. So these systems must be tested in real world and justice. In some low-income countries, necessary data may not be gathered, and there may be racial or national differences. How do clinics manage AI systems? There must be necessary sufficient information, and parents must be informed. And the system must be managed and controlled by humans. And the humans must be responsible for the AI applications. Epistemic humility. The situation, like if any source, be it human or AI, is not enough in any case. And I think it must be combined, human decision and AI decision. So the AI will not be the authority which takes the final decision. And this way will be more respectful towards doctors. And also AI may mark someone as a child as high risk profile due to a couple of symptoms. Okay, AI gives some data and some results, but it might be wrong. It may give some wrong information. Some epistemic humility, epistemic justice must be applied. Children's data are very sensitive. So there are biometric genetic data, and the fact that they used that widely is the reason to redefine these applications. So if a person's name and place of the address is given, so there is no privacy. Privacy is lost. And the cloud platforms are open to cyber attacks. Also, there are some commercial AI applications where location and other personal information are shared. Is it ethical enough? In this regard, legislation, regulations are very important. There are a lot of legislation applications developed in European countries. There is framework presented. AI data before going to the central database stay in the system and get updated in the system. And thanks to this, the data is not collected in the center, so the privacy is protected. Also, blockchain, and thanks to this, the data who has access to the data can be controlled, and privacy is protected this way. As I told, In the 80s, in the UK, privacy issues became very important. If the teenagers understand the consequences of their actions, they must be involved in taking decisions. Sometimes AI decisions may be considered as pressure by the patient. And at this point, the most important advice is to get verification from the patient, how to use the AI in the treatment, to explain everything very clearly. It must be done under the human control. So it must be controlled by the clinicians. As I told earlier, the AI models foresee white middle income personalities. So neurodiversity is not foreseen mostly. So the system already has injustice. So it helps to deepen the injustice which already exists in the system. And the AI is distributed unevenly. So you show some factors, some data, and the system, the AI system, labels you in certain way, like you have this or that diagnosis. And sometimes, in a very inappropriate manner, adult data may be transferred. So what is the solution? To use data according to children psychiatry and to calibrate AI data and to evaluate them in different groups. It may be different according to different groups of population. So this must be checked. Also globally, it's very important to be in coordination with local health authorities. AI is not human and doesn't have emotions and cannot develop emotional connections with people. So we, as psychiatrists, create connections with our patients that IA is unable to establish. And it may be very confusing. Attachment displacement, we call it attachment displacement. Sometimes children may connect with the AI and may humanize it. It can be confusing, and they should not trust the AI that much. AI should not be decision maker, but the clinicians must be. So clinicians must monitorize the AI applications and present the children with re-evaluated solutions. So who must be in charge? This health system, the developers, or the clinicians? The most important issue is the ability to keep the AI under control. The humans must not be excluded from the process and is expected to take important role. So the trauma stories must be kept in memory. And so the institutions have their responsibilities as well, ethical, and health institutions must develop necessary protocols. And this way, clinicians will not only will not
There are some suggestions about directing the AI usage in this area. We have a Pearl AI framework, confidentiality, respect. It is translated like that. Those are important in AI applications. Being human focused is important. Not only accurate results are important, explainability and transparency is also important, and inclusivity in the clinician system is important. Children's rights are important. You, UN in the UN system, in every decision, those supposed to be considered within the regulations and in the time of design process. Both families, ethical decision makers supposed to be working in cooperation in the design process. Institutions has major responsibilities, as I all told you before. Regular ethical inspections and justice inspections should be done. And in summary, AI actually offers new opportunities, personalized support, momentary observation, but it also provides ethical risks, a breach of confidentiality, and prejudiced decisions. The children need special protection from those data of theirs. And I would like to emphasize, last but not least, ethical AI is actually possible. What it needs a transparent structure supposed to be built in order to reach that. Thank you very much.